at D2 ward at Khartoum Teaching Hospital in 1991. And then in 1992, we moved to Soba to another small, very small, miserable room. It was a side room of the endoscopy suite that time. And then we start to improve things gradually in the center. The justification of this center, Mycetoma, it's a health problem in the Sudan. It is a health problem, not a very major, but it's a really health problem here in Sudan, affecting most of the central part of the Sudan as well as the eastern part of the country. Although Mycetoma in Sudan is common, and Sudan, it seems to be the Mycetoma homeland, the disease is badly neglected. Neglected by patients, their families, medical community, and the state. Because it is not a glorious disease. Even between our colleagues, we have a problem with managing patients with Mycetoma. Again, because it is not a very glorious disease. And you can see this as an example of referring cards and problem with the term used in the treatment of Mycetoma patients. It affects young patients, and they are really young patients. They are the cream of the society, and they are the future of the society. And you can see if a patient like this with a brain Mycetoma, a young child like this, you can see the outcome of the problem. Most of our patients are of low socioeconomic status. And this is one of the patients coming to the clinic with this vehicle, amputated, and happy to carry her cart at this. One of the important justifications is still, in many centers, Mycetoma treated by amputation. And again, amputation is a big problem in the Sudan, with all its social, medical, and financial impacts. And you can see this is a young lady with amputation. She is happy, she is smiling because that was the end of her problem with a long-standing disease, bone destruction, secondary bacterial infection, anemia, and malnutrition. Mycetoma has a high morbidity and it can be fatal. And this young lady, she came with intra-abdominal pelvic Mycetoma involving the anterior abdominal wall, the pelvis, and the perineum, and the vulva. And you can imagine a young lady, she's 21 years old with all these problems. She got divorced from her husband from the disease at this side. It can be as miserable as this. And again, this is one of the justifications of having this center, massive cranial Mycetoma. It can be as miserable as this. Mycetoma of the knee, of the side, and the anterior abdominal wall. I'm very happy to say this patient was cured some months ago with the medical treatment. Amputation, and it is social, medical, financial problem. A patient with Mycetoma, he had an adequate surgery, he had a recurrence, he had a recurrence to the anterior abdominal wall, and intravesical spread. One of the justifications is still there is a lack of health education among these patients and among the society. An important justification because it may be a preventable condition. If you know exactly the pathogenesis and how the infection takes place. The objective of the center are patient care, research conduction, teaching, and community development activities. The important achievement of the center, we managed to see more than 5,000 patients. We are approaching now the 6,000 patients. Most of them from different parts of the country, And I'm glad to say we're having patients from abroad. We're having patients from Somalia, from Eritrea, Senegal, Saudi Arabia, Yemen, and Bangladesh. And thanks for the internet and the telecommunication, we're communicating with these patients through the net and the emails and the other technology. And few of them are actually seen in Sudan. The patient care we are providing for these patients include medical treatment, surgical treatment, and health education. We have a good number of young staff in the center, and they are very much dedicated for patient care. This is one of the patients. She came with a mycetoma, actinomycetoma. She was pregnant during that time, and she had a treatment. And you can see how massive the mycetoma affecting the knee joints. And then halfway, 6 months after treatment, 1 year after treatment, almost complete cure. We never discharge these patients. They come for follow-up very regularly because they may develop recurrence at any stage. Another lady with massive cranial mycetoma. This is 6 months after treatment. Hand mycetoma. Lucky all these are actinomycetoma patients. This is just few weeks after treatment. We provide them with surgical treatment. We have a weekly session at Sub Hospital here. We produce a guideline for the management of mycetoma patients, and here I would like to acknowledge the effort of my late colleague and friend, Dr. Mbabi, for designing the first guideline for the management of mycetoma patients. Management includes investigations. The center was the first to use ultrasound for the diagnosis of mycetoma. Using the ultrasound, Dr. Ray here is going to tell us about this technique in identifying the grains and having a diagnosis and differentiating between the actino and eumycetoma patients. And again, the center was the first to invent the cytology and cell block for the investigations of patients with mycetoma and classification of the mycetoma into eo and actinomycetoma. And again, now we are using now the MRI for the diagnosis of mycetoma and to see the extent and to plan the treatment of these patients and to plan the surgical procedures. Professor Mahmoud will going to tell us tomorrow about this technique in the diagnosis of mycetoma patients. Regarding the research and the publications, we conducted the clinical research, basic research, and clinical research in collaboration with our colleagues in Newcastle, Rotterdam, and in Serbia. This is the publications. The Mycetoma Research Center has a good collaboration, as I mentioned, by Erasmus Medical Center, collaboration with Newcastle University, Center for Fungus Disease. Now we're going to have a PhD student be going next month to Utrecht, Holland, to have a PhD there. And then we have a collaboration with Cambridge University and Serbia. And Serbia, actually, this was an internet connection, an internet relation, and we have a publication together. We are involved in undergraduate teaching and education. We organize seminars for undergraduate students. We have a good number of exchange program students coming from Europe, from the American countries. And we have a continuing professional development activities. We have many training courses conducted here in the center. We have the annual international seminar in 2009. And I'm glad that there was a good participation from the international colleagues. And in 2002, this is the third international conference of mycetoma organized here. The center had contributed to the international meetings and conferences, and this is in Paris some time ago, and this is in Monterrey in Mexico. Again, this is Professor Welch Center. And we contribute again in the annual university conferences here in Sudan on scientific researches. In the area of community development activities, we had field visits where patients were seen, care was taken there, health education was conducted, and we organized and established the Mycetoma Support Society to help patients. I'm glad to see here Professor Sheikh and Professor Hassan seeing patients in the field, treating them, referring them to other centers if they need further care at that center. This is an outpatient clinic established at Kamlin, not far away from here. And this at the end of the day, another visit to Jazeera area, Professor Mohammedani and Professor Edward. Health education, the center has managed to produce a good number of brochures, leaflet in Arabic for patients. And this is one of the brochures trying to encourage patients for early reporting, avoid a delay by going to have a native alternative treatment. We have a website. The Mycetoma Support Society was established some time ago, trying to raise funds to support these patients, as you know, because these patients are from the extreme poor of the society. We have many international visitors. This is WR here in Sudan. Another visitor coming from the Caribbean. And recently we established the Mycetoma National Control Program in collaboration with the Federal Ministry of Health. The aim of this program is to eradicate mycetoma, as it is a live mutilating disease, through advancement in 4 important areas: treatment, education, prevention, and research. We hope with this program, availability of free treatment will encourage patients to present early. With early treatment, limb amputation rate will be reduced with all its socio-economic status and impact, and consequently the number of active patients will be increased. We're going to provide Sudan State with trained medical and health personnel for efficient management of patients. It's a teamwork. We have to work together. Ministry of Health, University of Khartoum, Soba Hospital, other colleagues in Duwaim, other colleagues in Sinnar and Gadarif. As without this teamwork, this project will not going to improve. This was posted in the outpatient department at the center some time ago, and I think we have to apply this. I would like to acknowledge the effort my colleagues, my senior colleagues, Professor Hassan, Professor Mahjoub, and my colleague Abdullah, Al-Rayah, and Yusuf, and my young colleagues, the researcher at the center. I would like to acknowledge the great effort of my colleagues, collaborators outside Sudan, overseas, Professor Goodfellow, Alex, Sibrin, Professor Daho, Henry, Zailestra, and my young colleague Wendy, as well as Erica from Mexico. At the end of this talk, I would like to thank you very much for being here, and we hope to see you in more collaborative work together. Thank you very much.
Thank you very much, Professor Fahal. And may I, on behalf of the audience, also congratulate you and your colleagues for the establishment of such a center and for doing such good work for the society. Thank you very much. Our next speaker, I think now we are moving into the 21st century. Our next speaker is Dr. Wendy Van de Sond. She started working on mycetoma in 2001, and she defended her PhD thesis in Rotterdam in the Netherlands, and ever since she focused on Eumycetoma, antigen discovery, antifungal susceptibility, and host factors. She is also the convener of Eumycetoma working group. Dr. Wendy, please.
I would like to thank you for the nice introduction, and I would like to thank the organizing committee for the opportunity to present the Eumycetoma working group to you. The Eumycetoma working group is a working group under the umbrella of the International Society for Human and Animal Mycosis. And I first want to introduce the ISHAM to those people who are not familiar with this organization. Well, the ISHAM stands for Human and Animal Mycology, and it's a worldwide organization that represents all clinical scientists and fundamental researchers with an interest in fungal diseases. The ISHAM has established several aims, and the first aim is to encourage the practice and study of all aspects of medical and veterinary mycology. The second aim is to facilitate an international base for the exchange of ideas, information, and to give assistance pertaining to medical and veterinary mycology. In order to reach out to the community, they developed a website, which you can see here. And on this website, there's actually upcoming events. So here you can see the conference on mycetoma announced on this website from the International Society. Also, physicians with problems with case reports can deposit their case reports under the case of the month, which you can see here. And other experts from all over the world can comment on these cases. Furthermore, you can also find some protocols on this website, for instance for DNA extraction, purification of proteins and other molecules, but also other molecular techniques, for instance for PCR, but also the preparation of cDNA libraries. Recently, also a division for young scientists has been developed by the ISHAM called Young ISHAM. And this is available for all scientists under the age of 35. These are usually PhD students or young physicians, and they would like to exchange ideas with their fellow PhD students. So there's a forum on this website in which you can ask your research questions to other PhD students and get answers back. There are also some games on fungal diseases present on this website. The last one is the third one is to publish an official journal, and it's now called Medical Mycology. This journal has an impact factor of 2.1, and its first issue was in 1962. It's now called Medical Mycology, but in the past it was called Subrodia and the Journal of Medical and Veterinary Mycology. In this journal you can find research reports about all different mycoses, including mycetoma, and these range from case reports to fundamental research. The last one is to organize an international conference at least once every 5 years. The last one was held in 2009 in Tokyo, and the forthcoming conference will be organized in Berlin in 2012. The preliminary program of this conference is already hosted on the website of ISHAM. So if you are interested in this conference, You could look at this website to see the program. Membership of ISHAM is only $50 a year, and for people coming from development countries, this fee can be waived. Since the ISHAM has an aim of establishing contact between different researchers of different countries with the same interest, it established the working groups in the about 5 years ago. The aim of these working groups is to provide a mechanism for the free exchange of information among members who share common interests in specific areas of medical and veterinary mycology. At the moment there are about 25 working groups, all with different subjects. One of these working groups is the Eumycetoma working group. We also have several aims, and first of all it's of course to provide an official body for all researchers and healthcare workers interested in all aspects of Eumycetoma under the umbrella of ISHAM. We encourage the study, so everybody interested in mycetoma is welcome in our working group. And we also want to increase the awareness of to the scientific community, because still many people are not aware of mycetoma in especially the Western countries. We also facilitate the exchange of ideas and information about epidemiology, immunopathology, diagnosis and the management of Eumycetoma. And we facilitate some working group meetings in big microbiology and mycology meetings through the help of ISHAM. And the last aim will be to facilitate fundraising by forming a large network of scientists which will enable us to help fundraising, for instance by the European Union. We launched a website which you can see here. It's Eumycetoma workinggroup.weebly.com, and you can find all kinds of information on this website. We established so far that we had a session in the Tokyo ISHAM conference in 2009, and we launched in this meeting also a Eumycetoma working group initiative. The second working group meeting will be in Berlin in 2012. Here you can see some pictures from 2009, in which Abdallah Ahmed and myself were the chairpersons. We had about 4 presentations, and we had also some posters on this conference. In this, the next meeting in Berlin 2012, they already gave us a spot for our next Eumycetoma working group meeting. As you can see here, it will be on Wednesday, the 13th of June in 2012. So I all welcome you to join us at this conference. At the conference in 2009 we launched an initiative because we noted that there were several mycetoma isolates which were previously identified as Madrella mycetomatis but were actually not. So we started an initiative to characterize these isolates. So we made parcels in which there were little tubes with media in which you could inoculate your fungal species, then put it in a specialized box in a safety bag and send it to the Rotterdam Medical Center. This initiative was also launched on our website. By sending us those isolates, we would sequence them, and we gave the sequence information back to the institute who sent the isolate. This was for reference as well, because people want to confirm some of the isolates. And so far we obtained isolates from France, India and Sudan. Most of the isolates sent in were so far Madrella mycetomatis, but there were actually 2 isolates of unknown origin. And one was recently named Madrella Fahali, because it was sent from this institute and in honor of Professor Fahal, who identified it. On Tuesday I will tell you something more about this isolate. We also got many isolates from India from Jagdish Chandra. And he told me that he had a problem not only with Eumycetoma but also with bacterial mycetoma. And he asked me if we could send some of the bacterial isolates as well. Although we are officially Eumycetoma interested because we are under the umbrella of the ISHAM, we're not only interested in Eumycetoma because mycetoma is a problem of both bacteria and fungi, so we included the bacterial isolates as well. It appeared that all the isolates obtained from India were Nocardia otidis caviarum. And there were so many cases that we collected the data from all these patients, and a paper is now in preparation. So you can see that by contacting the Eumycetoma working group, new collaborations can become existent. We also had exchange students. Nashra from the Mycetoma Research Center came to our institute, but also Hazabda Rasoul, shown in this picture. This was through connections of Professor Verhaal, but in the coming years it would be nice to contact the working group, and we might establish some more exchange students via the different institutes member of our working group. Because as you know, most research is best ideas come from exchange, so that you can exchange all ideas and new ideas can be formed. And in the future it would also be nice if we can get funding opportunities, because as you all know, it's very hard to obtain funding for research, especially in mycetoma, because so many people neglect mycetoma. At the moment it's even neglected among the neglected diseases at the World Health Organization. So by forming a large network of mycetoma experts, maybe in the future it will be easier to get funding for our research. And cooperation is also always better than competition. So if you want to join our working group, you can either contact me via this email address, or you can go to the website of the Eumycetoma working group via eumycetomaworkinggroup.weebly.com. Thank you for your attention.
Thank you very much, Dr. Wendy, for giving us insight into the international working group. Thank you very much. Now, this is the end of the session. If there is any question or comment or any historian around who would like to add some information. No. And I think, although the whole thing started early on in India, and mycetoma carries the name of India, Madura, mycetoma, I don't see many researchers from India in these groups and in these societies and meeting. Am I right in saying that? This, or are there any activities? Are there any activities in India which are going along with what is happening now in the field?
I don't have too much to say, but I was in India about 6 weeks ago, and I asked everyone whether there was a serious problem with, or any problem really with mycetoma, because I was very conscious of the early history that Professor Magoob went through. And everyone assured me that there was absolutely no problem at all, even though I was in Rajasthan, where I think there probably is a problem. So it's very confusing, and I'm just hoping that people in India tap into Wendy's website so that we begin to actually get proper information from India, because quite frankly I don't believe the people that told me it wasn't a problem. So I don't think that's very helpful, but I think we need to find the answer to this question. Thank you.
Thank you. This was true for some time. And the problem with the reports that we had and everybody talked about, they reflect the enthusiasm of the researchers. Mycetoma, as we said, has never been on the notification disease list in the ministries of health. So whatever is known about it has come from enthusiastic, concerned researchers. For example, here we have Mr. Maghrabi, rahmatullah alayh. He initiated the work in Wad Madani, and at that early time he worked with Juan McKinnon in Uruguay. So this is a personal effort early at that time, with the difficulty of transporting strains to mycological reference laboratory and so on. Whatever came from Africa or otherwise has come from the Pasteur Institute. So that's why it is, it does not reflect actually what is going on. The Indian scientists have 4 years ago held a conference on mycetoma. So, and I think the distinguished pathologist from India, what's his name? I mentioned him. He immigrated to Saudi Arabia, so there was nothing from there. We had reports from Saudi Arabia from him and from Ali Abdel Satir. Well, they are not Saudis, but they were interested in the work. And I think this is the gap where the coverage is not full. Thank you.
Through the YISHAM working group, I was recently contacted by Jagdish Chander, and he told me that there was some interest in mycetoma in India, but they found trouble in doing the research because the groups were so splintered and there's no collaboration in India. So I think that's also part of the problem. They want to do research, but sometimes they don't have the facilities, and therefore by contacting working groups they can do some research, and the interest is still there.
Thank you very much. Actually, Wendy said at the end of her talk that the WHO neglected Madura in the list of the neglected diseases, tropical diseases, NTDSs. And actually, yesterday I was reading through this, there were 17 diseases. And Madura is not mentioned among them. And also, they are adding snake bite and propioconiosis, which is a very funny sort of heavy metal which you get in your skin, and it looks just like swellings like the Madura. So may I suggest that from this conference, international conference, to write to the WHO asking them to put Madura, because really it's quite a big problem. Thank you.
Shall we blame Professor Mahjoub? He was in the WHO for some time.
I'm happy to say that DNDi, drug for neglected diseases, has now included mycetoma among its neglected diseases. They, of course, include particularly leishmaniasis, and they are supporting, our work here. LEAP, which includes workers not only from this country, but from Ethiopia, from Kenya and Uganda. And so that's something, encouraging, I think.
Perhaps we should push Professor Ahmed Fahal to have a post in WHO.
Shukran, Mr. Chairman. We are in the process now to apply for the collaborative center as with the WHO. Hopefully, if that was will be successful, that will try to put the mycetoma in the list of these neglected diseases. Thank you very much.
Thank you very much. I think We had a useful and informative session. I would like to thank the speakers and all those who have contributed to the discussion. Thank you very much indeed. We disperse.